Basavada. Now it's my honor to introduce you to David Chang. He will talk about why choose just one. I prefer Mix and Max. Thank you, David.
All right. You just heard a really good debate, and I'm going to tell you why they're both right. So I see my slides here, but I don't see them on the screen. Yep, all right. So I am a consultant for these companies. You know, I don't really like arguments, so I'm going to tell you why I use both. You know, both speakers alluded to having too many choices, and it can be like this dilemma for my granddaughter, what do you choose? And we won't go through the list of things that an informed patient really wants to know about. And Dr. Shetty mentioned this book that Rich Tipperman showed to me called The Paradox of Choice, in which the authors cite a lot of social experiments. And what you find is if you give people too many choices, it creates a lot of indecision and anxiety because there's a fear that I'm choosing something and I'm missing out on what I'm not getting, the so-called FOMO. And so this is why I think it is important to help people by making a good recommendation. They also, both speakers also talked about our dilemma. We have to be very efficient and yet very effective at helping people reach a choice with a very confusing value proposition with all of these optical terms. And so this creates a lot of anxiety for people. Not only do they have to choose which lens, but which distance is most important, and we get frustrated with the amount of time this takes and indecision. You've heard different approaches. I break it down by similarly to Dr. Shetty saying, well, you're either going to get a single focus, an extended focus, or a multiple focus lens. There's basically three choices. And I try to avoid monofocal because it gets confusing with monovision in English. If you have astigmatism, well, a toric feature can be added to each of them. Now, I think we'd probably have an easy decision if we had a lens that gave binocular distance intermediate. Patients had no problem driving at night, and yet they had that near convenience, cell phone, watch, makeup, price tags. But if this lens existed, we wouldn't have needed the debate this morning. It doesn't. But what you can do is blend the two. So if we're talking about avidity, for example, I explained that the strong side, especially in California where all of my patients drive at night, you have excellent night driving, but you're going to need reading glasses, very likely to see your text messages. That won't be necessary with the panoptics, but there's that risk of rings. And even though most people adapt, I have a little concern, as does the patient, about whether they'll be the exception. And don't forget that they're talking to friends, looking on the internet, and it only takes one person complaining about the rings at night to scare them off. So from the start, telling them you're going to get one of each, they're not having to choose. They're going to get that binocular distance intermediate, have no problem driving at night, and still be able to see their cell phone. And this immediately makes them happy. In the United States, a popular choice on the menu is a combination of the lobster and the filet mignon. That's called surf and turf. And I talk to my patients that this is like surf and turf. They're getting the best of both worlds, so the patient doesn't feel like they're having to give up something by not choosing the other. And of course, I explain we're going to start with one eye at a time. You're really going to test drive that lens. So if they're already myopic, I know they're used to near, or they hate glasses, we'll start with the panoptics first. I'll put it in the non-dominant eye, whether it's the worst cataract or not. If their main complaint is they're having trouble driving at night, I know I have to put the vivity at least in the dominant eye. And then maybe, maybe 1 out of 5 times, 1 out of 4 times, the patient says, I like this lens so much, I want the same lens. Well, that's easy. But you've already set it up that they're going to solve whatever they don't like about that lens by using the other choice in the other eye. And, although we can do mini monovision, as our first speaker said, I say this is actually no adaptation because you're going to have the same vision at distance and intermediate. And this is really important. If you're going to have only one eye for distance, you have to make it 20/20. And yet, sometimes they're 20/25 minus, 20/30 residual cylinder sphere. So boy, when you have the second eye at distance, that really helps because, again, 1 + 1 = 3, and you get that recruitment. Now, there's another choice with J&J. We don't have the Pure C yet in the United States. I think there's a little merit to using the same platform. You're really putting in the same material, same index of refraction, same chromophore, same edge design, and the same A constant. And so I think this has really made a difference, not just happy patients, but getting them to make that decision and eventually ending up 20 happy.